So the policy has been introduced to try and reduce the amount of unhealthy foods that are advertised within the Cheshire East borough, and the reason for needing to do that is the high levels of obesity and overweight that we have within our Cheshire East population. On its own, the policy will not significantly change those levels of overweight and obesity, but as part of a series of other initiatives, we're hoping to over time improve the health and well-being of the population. So foods that are high in fat, salt or sugar tend to be the highly processed foods, and the amount of nutrients generally is less within those foods. So you have a lot of unhealthy ingredients, and they are the things that contribute then to weight gain, and the reasons that we've introduced the policy is to try and reduce the level of advertising locally about those sorts of products, and particularly in relation to restaurants that might be advertising locally. We want to try and ensure that it's their healthy options that they're advertising when they're advertising on our advertising estate. So the nutrient profiling model was introduced by the government back in 2004-05 as part of their initiative to reduce the amount of advertising on television of foods that were high in fat, salt, sugar, and it is used to measure the contents of a food, and that measurement currently determines whether or not that particular food can be advertised on television. So it's an industry standard mechanism that's well recognised now by the advertisers, and so it just was sensible to utilise that for the purposes of our healthy advertising policy. Very much so, and in the report that we took to council, it identified that within Crewe, for example, which is one of our more deprived areas in Cheshire East, the levels of obesity and overweight amongst the children and young people in Crewe are significantly higher than in other parts of Cheshire East. So for those reasons, the impact in Crewe is likely to be greater than elsewhere, because there is a tendency for those sorts of adverts to feature more heavily in areas of deprivation because of the market that there is for people. Yes, it's trying to reduce exposure to those adverts, because again, research demonstrates that overexposure does impact upon people's habits and their actions, and so if you can try and either reduce the amount of advertising of those particular foods, or ensure that where an advert is appearing that it has that, as I said earlier, the healthy food option advertised rather than a food that is high in fat, salt or sugar, then it will hopefully influence people's choices as to what they eat or drink. Through the nutrient model, the nutrient profiling model, because that will be what determines whether or not we'll accept an advert. And the onus is on the organisation that is placing the advert to check that for themselves. We will then do spot checks to ensure that the policy criteria are being met. If we receive an advert that somebody wants to place onto one of our advertising boards that doesn't meet the criteria, then we won't accept that advert. So the intention is that it will be used to police the types of adverts that are put up on our advertising estate, and where the advert doesn't meet the requirements of the policy, then they won't be accepted.